Hello, I'm Sheryl McCarthy. Welcome to One to One. We've been so preoccupied with the coronavirus epidemic in the last couple of months that another major event has gone practically unnoticed. I'm talking about the 2020 census. Back in March, the Census Bureau mailed census forms to most American households, asking them to fill them out and return them by April 1st. But the health crisis has set back a lot of things. What's been its impact on the census? And why is the census so important anyway? Here to address those issues is Louisa Borrell. She is Distinguished Professor at the CUNY Graduate School of Public Health. Welcome.
Thank you. Thank you for having me.
Louisa, you're an epidemiologist. Why does an epidemiologist care about the census?
Well, an epidemiology studies the distribution of disease in the population. And one component of that study is to sort of describe who is affecting the population in the context of age, sex, race, and ethnicity. So with the census, we actually obtain the denominator for our calculation of mortality rate, birth rate, fertility rate, and other diseases. In addition to that, we monitor health inequality, and we use the census information to create sampling frame for most of our studies.
The census is also important for allocating public resources.
Absolutely, absolutely.
Correct. Are we talking about money for what kinds of things? Hospitals, police, schools? What kinds
We
of
talk
things?
about allocation of money for the healthcare system, for education, housing, transportation, policing, as you say, and all kinds of social services. But
Okay.
most important, for the political representation of the community.
For the first time this year, people can respond to the census online. So they can do it online, they can do it by mail. Can they also do it by telephone? Do you know?
Yes, they can. There
Okay.
is a touch line that they can answer the 9 questions or more over the phone.
In mid-March, you'll receive an invitation in the mail to complete the 2020 census. Then you'll be able to respond online, by phone, or by mail. It's that easy.
Okay, so the Census Bureau, if it sees that certain people have not responded to the census by a certain time, we're past the April 1st deadline, obviously, then it sends out census workers to sort of goose people into responding to the census, correct?
Yes, so this year, the census workers are supposed to go out from May 27 to August 14. However, that's going to be contingent on where we are with the lockdown and the social distancing approaches for the COVID-19.
So basically the census workers have not been able to go out.
No.
That's been pushed back. Okay. I understand figures that I saw is that as of April 22nd, about 52% of American households had responded to the census. That's compared to, I guess, 66% around this time in 2010. So the count is really down. I was looking at a sample census form. The kind of information that they ask for is really pretty basic. You know, age, sex, race, how many people live in your home, how they're related to each other, do you own or rent, and phone number. And that's pretty much it. I was surprised that they don't even ask for income or occupation.
No. Most of that information is coming now through the American Community Survey.
A lot of households that contain perhaps undocumented immigrants are worried that if they respond to the census, you know, ICE will come and carry them away. But there's no questions asked about citizenship, correct?
That's correct. No question about citizenship or legal status.
Okay. So if I'm a person, the head of a household that is sheltering say 6 undocumented immigrants from my home country, is there any reason why I should not tell them that there are 7 people living in that apartment as opposed to 1?
No, you should actually say that there are 7 people and provide the information related to each one of those 7 people. Because
Okay.
remember, depending on the age distribution in the population, the service and the funding are allocated. So
Right.
if we have younger kids, that's going to be more investment for education
Right.
and for
And
social programs that support kids.
And one of the big concerns is that the immigrant population is undercounted, correct?
Absolutely,
Okay.
especially Hispanic,
Why Hispanic? Why especially Hispanic?
because 50% at least are immigrants.
Are they?
And
Okay.
somehow you either know or somebody in your family it has some legal status that is concerning.
Yeah. There also tends to be a lower rate of response by African Americans. Why is that?
I think it's trust. For the African American community, it's trust. And in fact, in a study released last year in June, it spoke that this sort of found that, oh, not found, suggests that this is going to be the census with the larger undercounts in 1990 because of the trust in the government.
They just don't feel, they feel, I don't want to give any information about myself to the government because I don't know what they're going to do with it.
First, I don't know what they're going to do with it. And second, what are they going to do for me?
Yeah, yeah. About 92,000 people are incarcerated in New York State, in jail and in prison. Do they count
Yes,
incarcerated people?
they are counted by the incarcerated and prison system.
And are they, if I'm a person who's in an upstate prison, am I counted as residing in the town where the prison is, or am I counted as residing in the neighborhood that I came from?
No, you are counted in the prison compound.
Okay. And I would think that that would have a negative impact on Black and Latino communities since they are disproportionately in prison. And instead of their neighborhoods getting the resources,
Exactly.
according to that population, it's the community that has the prison that gets the resources, right?
Yeah. In fact, 38% of the prison population is African American or Black.
Yeah.
And 22, 24 is Hispanic.
Yeah.
So
Yeah.
that resources are out of the community.
Yeah, I remember going to one summer, this is a long time ago, I worked one summer for the Board of Correction, which is a city agency that monitors city prisons. And we went on a field trip to Rikers Island. And what struck me more than anything else is that almost all of the prisoners were Black, Latino. I mean, maybe
Very
1
sad.
in 100 was a white male, but
It's very sad.
it's very striking.
It's very sad because the proportion of men, minority men that are in prison is the working age.
Right, right. But instead of working, they're in prison.
Exactly.
During the 2010 census, were there any particular neighborhoods in New York City that were especially undercounted?
Based on a project that is doing the Graduate Center, 36% of the neighborhood in New York City were undercounted.
Really?
And what they call undercounted is any neighborhood that the response rate was less than 75%.
Mm-hmm, mm-hmm. Do you happen to know where did those neighborhoods tend to be concentrated, in the Bronx or Brooklyn? I hear that Queens had a major undercount.
Yes, Queens is probably the one with the borough as a whole with the major undercount. The response rate last year was low, in 2010 was lower than the other borough. It was barely making 60%.
Why do you think Queens?
Queens is very unique when it comes to the demographic characteristic of the population. So whether you compare to the city or to the state, you have more diversity. You have approximately 28% of the population is Hispanic, 26 is Asian, which is the larger proportion of Asian in the city. Out of those, almost 50% are foreign born. There is the highest overcrowding, housing overcrowding, meaning that it is a large proportion of family living in multi-generational family with the parents, the grandkids. And the other issue is that Queens is a working class borough.
Now, what does socioeconomic status, how does that affect the census?
It does. It does, of course. But then the problem is that the socioeconomic status is so tightly aligned with racial ethnic minority.
Right.
So it's whether you talked about one or the other, you're capturing the same concept.
Right, and it's also connected to immigrant status as well.
Absolutely,
Okay.
absolutely.
Okay.
So most of the people in Queens are in a low-paid job and opportunities that allow for very little flexibility or mobility.
Tell me, a little bit about your research and what kinds of things you have learned by in terms of, health issues or whatever, by analyzing the census data, some of the areas of your research.
So although I'm trained as an epidemiologist, my area is social epidemiology, meaning that I am more interested in the exposure and how social constructs such as race and ethnicity, socioeconomic status, and your neighborhood affect your health. So through the census, one of the things that I have learned is that rather than blaming the victim and focusing in the risk factors that the individual have, we need to focus more in the area or the context in which people live and interact and how that area shape the behavior and the risk factors of individual. So just to give you an example, we know the proportion of minority and the proportion of people living below poverty in the neighborhood are indicators for fast food restaurant. The same is true for liquor store. So if you do a study and you ignore that context, then you will say, okay, alcohol is associated with cardiovascular disease. Alcohol is more accessible for a particular community.
And more junk food and less really healthy food.
Exactly. Less investment in park, less safety to walk. Yeah, less safety to walk.
And what are some of the health ramifications? I mean, we hear, certain African-American communities, higher incidence of diabetes, I think asthma. What other kinds of things?
Obesity. Let's think about obesity.
Obesity, right.
Which is it can be considered a condition and at the same time a risk factor because affect diabetes, affect cardiovascular disease, cancer.
Right.
And one of the issues with obesity is that people live in unsafe neighborhood, that they cannot exercise. They also live in neighborhood that sometimes don't carry a lot of fruit and veggies because those are perishable. If the bodega or the supermarket doesn't sell them, they go in the garbage. So they have less availability of those products.
Right, right. I would expect probably lead poisoning as well.
Or lead poisoning being a big issue. And in the project, there have been a study that they have found a lot of mole, roaches, and things like that that are associated with the high increase of asthma observed in African American and Puerto Ricans.
Right, right. CUNY has gotten involved or hopes to be involved in helping to get the census out. Tell me about the CUNY initiative.
So CUNY have partnered with the City Council and the New York City Census to sort of help and to ensure that we have an accurate and fair count. And when we talk about fair, we talk about a clear representation of the diversity of the city.
Right.
So the way that CUNY plan to be involved is three ways. First, engaging students. Second, getting this initiative of Get Out to Count and community organizing. So for the student side, CUNY has recruited 260 students to become the CUNY Census Corps. And out of those students, at least 70% speak a language other than English, for a total representation of 47 languages. When it comes to the Get Out to Count, as you know, CUNY have approximately 45,000 employees and 500,000 students. And the majority of the employee and student are part of the Hard to Count community. So CUNY has promoted the importance of participating in the census. So the students and the employee serve as a voice to ensure that the census is carried through. The last part is the community organizer. And this year, CUNY had a city fund program to provide funding to community organization, and 150 of those funds went to projects related to census. So
now, will the CUNY students be actually going door to door or making phone calls to people who haven't responded?
That was the plan. That was the plan, that the CUNY
Hopefully,
students,
eventually, when we get out of lockdown, they'll be able to do that.
absolutely, that was the plan, that CUNY students were going to go out there. They were going to be carrying an iPad or some sort of digital device that they could help people complete the census, or call in the phone. I imagine the calling in the phone is going to happen, but as you know, because our life has changed, people don't want to be in the phone.
Right, right.
But hopefully, if this lockdown ends before the end of May, maybe the last part of the targeting for the census worker, maybe the CUNY student will be a big help.
Is there a deadline for collecting the census information? I mean, do we say, well, we wrap this up in October, or we wrap it up in December, and after that we don't do it anymore? I mean, I'm sure it could be pushed back because of this year, but is there tend to be a deadline for that?
Yes, so the deadline for being out is August, usually August 14, August 15. And then there is a count until October. And in December, the census have to provide the information to the government.
Okay, okay. Now I understand that you have had a 3-point proposal for sort of saving the census. Is that those 3 things that you told me, or is it something different?
No, that 3 things are CUNY initiative.
Okay.
For me, I think that education is the most important. We need to educate people about why it's important that everyone get counts, because this is going to have implication for the next 10 years for our health, our social services, our community, our city, and our state.
Your response to the 2020 census informs how hundreds of billions of dollars annually are allocated for hospitals, emergency response, schools, and other public services, and used in business decisions over the next 10 years. The 2020 census also determines the number of seats the states will have in the U.S. House of Representatives.
Is there any interesting research that you are conducting right now that you'd like to tell us about?
Well, right now I am very interested in examining the discordance or concordance of parents, race and ethnicity, and birth outcome. So whether the parents are of the same race or different race and ethnicity, whether that affect the outcome of the pregnant woman. And for that, I'm using information from the New York City Department of Health.
So you use, what are the different sources of data? There's a census, obviously. There's information from the Department of Health, other sources?
I use a lot the National Health and Nutrition Survey, which is a national survey. It's conducted every other year.
Mm-hmm. Now you are, in addition to being a PhD, you have a degree in dental surgery, is that correct?
Yes, I'm a dentist.
How did a nice dentist like you wind up doing this kind of work?
Well, I came from the Dominican Republic with a dental degree, and I figured that was the easy way to get into the market and continue doing the things I like. But I find out that dentistry is practiced very differently here. I went back to school and everything, and I got my degree, but I found that here is a distrust.
A distrust of dentists?
Between the patient and the dentist. So the patient feel like they had to be washing over your shoulder all the time. And that was not the reason why I went into dentistry. I went into dentistry because I wanted to help people. And I realized here very quickly that if you don't have the money, you can only help a selected portion of the population. And also the distrust, I was like, this is not what I want to do with my life. So I went back to school and I got a doctorate.
Yes, I would think that there is a big discrepancy in, dental work is not covered by most insurance plans. What's the status of dental health here, and especially among working class communities?
Very bad. They had a survey in Harlem, specifically Harlem community, and the main issue was oral health. When people were asked, what is your major complaint? Oral health. Because as you say, insurance doesn't cover that. Even if you have a public insurance, what it covers is basically emergency treatment.
Right. Or maybe a couple of cleanings a year.
And that's it.
What's the main message you want about the census that you want to send to the viewers of this show?
Well, I want to re-emphasize that an accurate and fair census is crucial for the allocation of resources and power for the next 10 years, not only for our immediate community, but also to the city and the state.
Okay.
So we have to go out there and participate.
We are living in unprecedented times, and the census remains constant in our democracy. Together, we will meet our constitutional duty and count all persons in all communities across our vast and diverse nation. Stay safe, everyone, and remember, you can help shape your future. Respond to the census at 2020census.gov.
I want to say there's going to be a virtual town hall meeting about the census. It's called Harlem Counts, and that's going to be held on April 27th, 3 to 4 in the afternoon on Zoom. What are they going to be doing at that?
So we have a panel. I'm going to be part of that panel, and with me is going to be and especially from the New York City Census, and a community leader from Harlem. And what we are going to do is we are going to make a case from different perspectives about the importance of the census, and then open for question.
Okay.
To the community. community that may have any question about exactly the issue that we are talking about, trust, about fear, to sort of mitigate that and make sure that people participate in the census.
Why Harlem? Is that a community that has been undercounted in the census?
Two reasons. First, it has been undercounted, but also we are located in Harlem. We are located in 125th. So
Okay.
we want to make sure that we have a voice in our community.
Okay. Well, I think it's a great thing that the census which has really been overshadowed by the coronavirus thing, is information is coming out on that, and that you'll be able to get more people to participate. I'm afraid we're out of time. I'd like to thank Luisa Borrell, Distinguished Professor at CUNY's Graduate School of Public Health, for joining me today. For One to One and the City University of New York, I'm Sheryl McCarthy.